About this particular part of the program, where we're going to be trying to challenge the really big issues about evidence and evaluation. And I'm delighted, as a sort of, I said a warm-up act, but for our debate, to welcome Alexia Tonnel from NICE. Alexia is the Director of Evidence Resources and has taken on, I think, a really tough problem from the National Information Board, which is developing this framework for evaluation evidence around trying to understand how we sort out the wood for the trees, what's effective, what works, what we can recommend in practice. And it's no easy task. But I think it's very important to see this as very live. We had a meeting yesterday. It's a very problem that we're grappling with, and hopefully our debate will really sharpen up some of the issues that we're trying to understand. So could you please welcome Alexia? Thank you.
That's great, thank you. Thank you very much for welcoming me today. So what I'm going to do is give you a quick overview of the work we have been doing together with Public Health England, the HSCIC and NHS England to try and develop a framework for assessing apps. And by apps, we mean apps as mobile apps, but also web-based services, effectively. It's a sort of a slightly broader scope. And run through basically the concepts and the challenges we're grappling with, because we haven't got the answer yet. So it all started with this document that was issued in November last year, which is Personal Healthcare 2020, which was developed by the National Information Board, which brings together leaders, senior leaders and digital and technology experts from across the NHS and social care, as well as patients and clinicians, to provide leadership and guidance as to what the priorities should be for deploying technology and digital across the system. And this document is really interesting. It is quite big. It is full of recommendations and commitments, which are going to be a challenge in some areas, but some progress has started to be made. And all these recommendations were streamed into sort of 5 work streams. We talk in code when we work with the National Information Board, and our code is 1.2. So 1.2 means the apps work stream. And alongside the apps, there's work around transparency, working on the My NHS site, which some of you might be aware of, data privacy, development of NHS.uk, which is looking at supporting transaction for healthcare provide in between patients and healthcare system. So lots of excellent work that's going on around secondary use of data as well, etc. So we're one of many, and we're the one called 1.2, basically. Now, why are we doing this in the first place? And many of you will recognize those reasons. The first of them, which is the market, is not the market for apps. The wisdom of the crowd is not working, is illustrated in this diagram here. So on the x-axis here, you've got what this study is looking is at the number of smoking cessation apps that were developed, I think, mainly in the US market. So many of those were built in the US. And on the x-axis, you've got the extent to which these apps conform with guidance on supporting the smoking cessation. And on the y-axis, you've got the extent to which they were popular in terms of their ranking on websites, on app stores, etc. And you can see there's no correlation whatsoever. If anything, there's a negative correlation that the more popular apps were less based on evidence. Now, it might not mean that they were not working. They might have been working with lesser evidence, because they were maybe more exciting. Who knows? But that's the worry here. And based on this as well, what you have as well is the worry that professionals are not ready to recommend, commissioners are not confident to go and buy the system. There's no sort of national level sort of stamp of approval that says to commissioners, yes, this CCGs has bought it, and it's good enough, it's met some basic requirements, you should go and have it. But also, as a result of that, the organizations that are making really good apps based on evidence, that are looking to demonstrate the evidence, well, they don't really have a mechanism for making a difference, for standing out, and therefore where's incentives for them to go through this effort? So these are sort of the issues why we need, the reasons why we needed something. there are considerable challenges in trying to do this, and one of the key ones is that the numbers vary, but between 130,000 apps out there, 200,000 apps, who knows? There's a lot of them across that hit the UK, but also more globally. And the key tension for us is how focused we are, and that's what I have there at the top on this arrow. We could open it to all, or we could just go in certain priority areas. For example, mental health would be an obvious one where it's been already extremely well developed. We could look at all risk level or focus on things which are higher risk, if risk is understood to be a big reason for trying to do assessment. We could look just for indicators of quality, or we could do a robust assessment that really says this is working and this is really safe. So where do we put ourselves on this spectrum then drives the challenges are underneath there, which is to which extent are we able to support innovation? If we limit ourselves to one or two segments, then what happens to innovation in other segments where the new stuff is actually happening? Because things are already happening in mental health, so should we support another area where there's less development? Building trust, if we do something which is too quick and dirty, are people going to change behavior and follow it? But if we try to do everything and do everything really well, then we need to buy the moon or whatever, and it's impossible, we can't afford it. It has to be affordable. So that's where we end up in this emerging value proposition that we have as to what we're trying to do here. We're not a regulatory process, so will not give permission to operate in the market. In other words, we're trying to identify and promote the best apps in the health and social care system. We're not trying to find the rotten apples, if you will. So if you think about a bell curve of apps, assume it's a bell curve of a few really dangerous, nasty ones, a lot of average stuff, and then a top end of really high quality stuff. We're trying to find that top end, that sort of end part of the bell curve. That's what we're looking for. In doing so, we hope we can provide a benchmark in terms of standards, expectations, that can help app developers across the system to do better. So we create a virtuous circle. Because of proportionality, we need to be able to think that all apps don't need to be assessed in the same way if they are going to be assessed, which itself implies a lot of other questions. And the most comprehensive assessment is likely to be for apps that have the potential to have a high impact, to be defined. A high impact for whom becomes the issue here, and are probably higher risk. And the risk here is around safety and potential data security and privacy. But all of this, and another one that I didn't put in on here actually, which came up early on today, is the importance of creating also confidence and building evidence across the system, so that over time there is increasing level of evidence that the digital technology is working, is making a difference, and people don't doubt it at scale. I think our first speaker mentioned this recent study, and people are saying, oh, well, let's not buy this stuff at all now because there's evidence it doesn't work. And we need to be able to get people to be a bit more discerning around the information that they see about digital. But the last point is very important, is we're very clear that if what we produce is a fantastic list of amazing apps that we've evaluated in a perfect way, and we just sit it there somewhere in the ether, and nothing is going to happen. So we need to think about ways by which a doctor, a GP, would be able to recommend an app, what sort of system will we support them with for it to flow. We need to be able to reach the commissioners to tell them about this and provide them guidance as to how it might influence them, and also promotion. And we really need to think about where people find apps, and we need to have an impact on those stores. So we're talking to Apple and Google, for example, to see if there's a way, as and when we develop assessed and assessed apps for them to promote those. So we're not trying to reinvent a new source of access to apps because it's not going to work. So we are very clear about this. So that's the value proposition. One way of achieving this value proposition is to think of the assessment as a phased approach, where not all apps need to go through the same thing. Maybe some apps don't need to go through this at all, by the way, or we decide they can't, or we can't afford them to go through. But the idea is that stage one and stage 2, which is a blend of self-assessment and light crowdsourcing, still to be defined, although we're starting to understand better what we can achieve there, would be assessing things such as, a number of technical factors such as privacy, accessibility, interoperability, elements of safety around reliability of the content and the algorithms that are being tested and are working, and then usability in terms of best practice being applied. And then some apps, we might decide to then go further and assess through helping them with study development or providing guidance more generally about types of studies to undertake, and then an independent assessment to be able to assess impact. And impact can be defined in lots of ways. The most basic way, it's usage. Actually, if it's something is used, you have a chance that it might be doing something. So it's a first stage of assessment, and then effectiveness, cost saving, behavior change, and other user outcome factors as well that we need to think about. So that's sort of where we are now. The next problem that we face, having developed this and starting to pilot and develop the questionnaire for stage 1, by the way, so we've taken a number of apps through a very early prototype of this, of the stage 1 pilot. One of the challenges for us is, okay, who goes through which stage, and does each stage look different depending on which type of app you are? So we need to think about how we segment the market of apps, and there comes another big problems because there's tons of different ways you could segment apps. So we need to think about ways of segmenting that will help us, that are connected to the assessment. Who is using the assessment, the outcome of the assessment, what kind of information do they need to make a decision, and therefore how far do we take app X or Y through the process in order to allow the system to make a decision. So this is very new. That's as far as we've got. And sorry, because the format changed at the last minute, so I tried to squeeze it back in, so it's not quite looking perfect. But this is where we got to in terms of thinking, an initial way of thinking about segmenting the sort of market of apps, if you will. And the next question will be which one goes through which stage and how. But this is starting to help us think about the options we have. So what type of apps? And here, what they are is apps used by professionals. So it's B2B apps. Then you have apps which are digital intervention, which a lot of the things we've seen today are that, because it's about providing ICBT, for example. Apps supporting care monitoring by the professionals, so where there is monitoring of the disease and there's a professional on the other side is looking what is happening and connecting. So the benefits you get from this is maybe around efficiency, speed, ratio of professional to patient, etc. And then you get into the other areas around category D and E, where it's about self-care or prevention, sort of self-involvement in prevention with people with self-care who already have a disease diagnosed and decide to do something. And that's where the thoughts around the NIB and doing something and engaging patients with apps initially originated, because the idea is that self-care might be the solution to the burden of the NHS in the longer run. Whether or not that can be achieved, I think there's a lot of expectations around this. But over time, people might manage their conditions better and lighten the burden to the system. So that's an important category. Prevention and supporting all the priorities of Public Health England and the public health professional across the country around key risk factor. And then the last one is more around fitness and well-being, when people are doing things that might help them on the other categories, but it's not in the context of a health issue. So the types of apps will have different types of challenges in terms of the evidence base that we can find for those and how much has been collected, the type of benefits that these apps are trying to achieve. But also you start seeing actually how much do they cost typically, those apps, which are the expensive ones, who is buying them, and where's the NHS bearing the cost, and should the focus of this piece of work be on where the NHS or the system, as social care is also covered here, has to pay for something. And so you start to think about maybe some apps go through some parts of this and more rigorous or full assessment of impact, and relative value is done on other categories. And we haven't got the answer on this, but it's where we got to so far. Ongoing work. We're speaking to a lot of people. A lot of people in this room have come to our meetings that we have on a weekly basis, where we bring people to talk to us. They might come from the industry. They might come from patient organizations, from a clinical or academic background. So we talk to a lot of people. A key issue is particularly for this prototype we're developing around the self-assessment, is not to duplicate standards and guidelines that exist out there already. We really want to build on what exists already. We're not about developing new standards. Some of those we're waiting for them, because we know the NIB is developing new standards and guidelines around data privacy, so we'll make sure we adopt those. We're doing some work with some of our colleagues, including Chris, around thinking around literature review and methods work. User research with citizens, professionals, and developers and funders. We've kicked off the work, the user research on the professionals, and we're really keen as well to add to this, the funders are there, the commissioners. What do they need to make a decision, and how do we focus our work on this? And we've spoken to a lot of them. It's just about structuring further research in the detail. There was a funding decision. Well, there has been a funding decision. We don't know the outcome for this work stream yet around the comprehensive spending review that concluded last week. We don't know what the settlement is for the NIB overall and the implications for our work stream, but we hope very much that we'll be allowed to continue to operate and get to a position where we can deliver something that gets the system going on this. Take a couple of questions. Sure, yeah. I'll take questions, yes.
Oh, that's fantastic, and I think it's just showing how live and real this is. This is something in progress, and we're trying to solve that. We take a couple of questions before we move on to our debaters. Jonathan, yeah.
Hi, that was very, very interesting indeed. Just one question: have you considered when an app becomes a medical device and how that will affect? Is that part of this process or not part of this process?
Sorry, I'm just going to go back a few. Oops. This one. So you can see self-assessment plus some external validation. If, as we assess the apps, as they get asked questions in what we call a stage 0, which would complicate this too much, then they might get routed and say, okay, before you proceed anymore, go to the MHRA and get CE marked with them. Because we don't, as I said, we build on and then come back to us once you've done that. And hopefully we'll feed more apps through that process as well.
Yes, Bonnie.
Hi, Simon Lee, health economist. Just a quick one on outcomes. You say kind of everything needs to be maybe tailored in the way you assess it. With the self-assessment and the external validation, I think a big problem is that with there being so many apps and with the app marketplace being so wide, a lot of apps just don't get enough downloads for actual rigorous evaluation in general. So is there some way that you can perhaps horizon scan and promote the apps that are showing kind of, provisional effectiveness and kind of like conditionally license them? Because I think at the moment there's a lack of incentives for developers to actually put evidence generation at the top of the prioritization list at the moment, especially with, and also with the outcomes. I don't think it's clear at the moment which outcomes should be used. So I think for depression, there's lots of different measures. For OCD, it's the same. And I think so that we're not comparing apples and oranges, is it worth having some kind of like compendium going forward? Kind of prospectively, we could say, okay, you're developing an app in this area. This is the outcome measure we'd like to see, so that you don't have to kind of like map between them all and doing direct comparisons. It just seems like moving forward, it might be, like a process for developers, like a pathway.
I think there was a few questions in there. I think there is something about whether or not you should kind of put a filter at the beginning based on number of downloads. Not a bad idea. It could be a way for us of assessing whether something can be successfully, sort of assessed and further validated through crowdsourcing. The problem with that is innovation. Does it mean it pauses, it limits the ability of something quite new to go through? I think, what was another question towards the end? Was more around...
kind of providing clear guidelines as to what outcomes you'd like to see, rather than
yeah.
very variable.
what we are trying to think is in terms of the shape that the independent assessment is taking, whether that independent assessment is something we can do for individual apps, or whether we can develop mechanisms for doing, because NICE is a health technology assessment organization, so we tend to think very quickly, go straight there. So we try to step back and think that's not necessarily the solution for everything. Solutions could be one assessment, and then based on that, development of criteria for the category in which it belongs, and maybe that could accelerate then the process for those categories of apps. So we're starting to think about that, so kind of a Me Too assessment mechanism, and maybe some guidance for a category of app. But the problem is that when we discuss this with some academic experts around this is, what you need, and as we've seen for OCD or for anxiety or for depression, is going to be very different. So you end up having a lot of, very, very small, narrow pre-guidance have to be pre-developed. And is that going to be much of a benefit over individual assessments? So it's a challenge.
It's time for one more. Is there one at the back? Yeah.
Over there. Yeah.
One of the big stumbling blocks I guess we are going to hit is if iOS or Android allow you on the app stores. Because I understand from talking to one of the exhibitors that iOS in particular restricts the amount of access that you can have to things like the accelerometers and other technical stuff within the phone. And in a way, aren't we almost limited by the power and the control that these 2 or 3 companies and potentially in the future Windows is likely to have on the whole app and the smartphone market?
It's a good question, and I haven't been in those conversations myself, but Dermot Green, who's the digital deputy director for PHE, has been in those conversations. We're talking to both Google and Apple to understand with them to which extent they are interested in the outcome of this assessment and how they might promote it as part of their store. So I think you're right. There's an issue of access for apps into the app stores in the first place, and that's probably one part of your questions, and we're going to be affected by that. But I think we're looking for really good apps that ought to meet the requirement that those players put on the apps. And then the other end, the outcome of this assessment, we hope it can be part of what is being displayed on these stores, although that's work in progress.
Okay, great. I'd like to thank you again, Alexia.